Hello friends. In the last video we just had brief introduction on Oasis E and new changes. Now I came again to discuss all the new sections in detail. But before starting our today's video, I am requesting to those friends came here for the first time, please check out my last video on Oasis E new updates for home health coders. I also want to thank you all of those who do likes and share my video and subscribe the channel. Lastly, please share such valuable video to your friends so they can also aware the new updates. Okay, so these are the sections we will discuss in today's video. B0200, Hearing. This section contains 4 codes. Code 0 for adequate, it means patient does not have difficulty hearing in normal conversation, social interaction, or listening to TV. Code 1, minimal difficulty, when patient has difficulty in some environments, for example when a person speaks softly, or the setting is noisy. The patient hears speech at conversational levels but has difficulty hearing when not in quiet listening conditions or when not in one-on-one situations. The patient's hearing is adequate after environmental adjustments are made, such as reducing background noise by moving to a quiet room or by lowering the volume on television or radio. Code 2, moderate difficulty, speaker has to increase volume and speak distinctly. Although hearing deficient, the patient compensates when the speaker adjusts tonal quality and speaks distinctly, or the patient can hear only when the speaker's face is clearly visible. Then the appropriate response would be to moderate difficulty. Code 3, highly impaired, absence of useful hearing. The patient hears only some sounds and frequently fails to respond even when the speaker adjusts tonal quality, speaks distinctly, or is positioned face to face. There is no comprehension of conversational speech, even when the speaker makes maximum adjustments. B1000 Vision. This section contains 5 codes. Code 0, adequate, if the patient sees fine detail, including regular print in newspapers or books, the response would be code 0. If the patient sees large print, but not regular print in newspapers or books, would go to code 1 impaired. If the patient has limited vision and is not able to see newspaper headlines but can identify objects nearby in their environment, the appropriate response would be code 2, moderately impaired. Code 3, highly impaired, if the patient's ability to identify objects nearby in their environment is in question, but the patient's eye movements appear to be following objects, especially people walking by, then code 3 should be selected. Lastly, if the patient has no vision, sees only light, colors, or shapes, or does not appear to follow objects with eyes, then code 4, severely impaired, would be right choice. B1300 Health Literacy. This section contains 7 codes. Code 0, never, it means the patient never needing help reading instructions, pamphlets, or other written materials from doctors or pharmacies. Code 1, rarely, means patient rarely needing help reading instructions, pamphlets, or other written materials from doctors or pharmacies. Likewise, if the patient needs sometimes help, response would be code 2, sometimes, or if the patient often or frequently needing help, code 3 often would be the choice. If the patient always needing help, then need to select code 4, always, and if the patient declines to respond or unable to respond, then code 7 and code 8 respectively would be appropriate responses. C0100 BIMS should be conducted. The Bims is a structured cognitive interview. A structured cognitive test is more accurate and reliable than observation alone for observing cognitive performance. Without an attempted structured cognitive interview, a patient might be mislabeled based on their appearance or assumed diagnosis. Structured interviews will efficiently provide insight into the patient's current condition that will enhance good care. This section contains 2 codes. If the interview is not be conducted, then code 0 no will be appropriate response, and if interview is conducted, then code 1 yes would be appropriate response. C0200 Repetition of 3 words. Coding tips for this section is nonsensical responses, incorrect answers, and questions the patient chooses not to answer should be coded as 0. Examples of nonsensical responses. Assessing clinician asks patient to state the year. The patient replies that it is 1935. This answer is incorrect but related to the question. Coding: this answer is coded incorrect but would not be considered a nonsensical response. Rationale: the answer is wrong, but it is logical and relates to the question. Assessing clinician asks patient to state the year. The patient says, "Oh, what difference does the year make when you're as old as I am?" The clinician asks the patient to try to name the year, and the patient shrugs. Coding: this answer is coded incorrect but would not be considered a nonsensical response. Rationale: the answer is wrong because refusal is considered a wrong answer, but the patient's comment is logical and clearly relates to the question. Assessing clinician asks the patient to name the day of the week. Patient answers, "Blue, that's my favorite color." The clinician asks the patient the question again to confirm the patient is not hearing the question incorrectly, and the patient answers with the same response. Coding: the answer is coded incorrect, the response is illogical and nonsensical. Rationale: the answer is wrong, and the patient's comment clearly does not relate to the question, it is nonsensical. C0200 Repetition of 3 words. This section contains 4 codes which are related to how the patient repeats the 3 words. For example, if the patient did not repeat any of the 3 words on the first attempt, then code 0 none would be appropriate response. If the patient repeated only one of the 3 words on the first attempt, then response would be code 1. If the patient repeated only 2 of the 3 words on the first attempt, then response would be code 2. And code 3 would be appropriate if the patient repeated all 3 words on the first attempt. Coding tips for this section. The words may be recalled in any order and in any context. For example, if the words are repeated back in a sentence, they would be counted as repeating the words. Do not score the number of repeated words on the second or third attempt, only the number correct on the first attempt go into the total score. Do not record the number of attempts that the patient needed to complete. Examples. The assessing clinician says, "The words are sock, blue, and bed. Now please tell me the 3 words." The patient replies, "Bed, sock, and blue." The clinician repeats the 3 words with category cues, by saying, "That's right, the words are sock, something to wear, blue, a color, and bed, a piece of furniture." Coding: C0200 Repetition of 3 words would be coded 3 words correct. Rationale: the patient repeated all 3 items on the first attempt. The order of repetition does not affect the score. The assessing clinician says, "The words are sock, blue, and bed. Now please tell me the 3 words." The patient replies, "Sock, bed, black." The clinician repeats the 3 words plus the category cues, saying, "Let me say the 3 words again. They are sock, something to wear, blue, a color, and bed, a piece of furniture. Now tell me the 3 words." The patient says, "Oh yes, that's right, sock, blue, bed." Coding: C0200 Repetition of 3 words would be coded 2 of 3 words correct. Rationale: the patient repeated 2 of the 3 items on the first attempt. Patients are scored based on the first attempt. The assessing clinician says, "The words are sock, blue, and bed. Now please tell me the 3 words." The patient replies, "What were those 3 words?" The patient's response is coded and then the clinician repeats the 3 words plus the category cues. Coding: C0200 Repetition of 3 words would be coded 0, none of the words correct. Rationale: the patient did not repeat any of the 3 words on the first attempt. C0300 Temporal Orientation. Coding instructions for C0300A, able to report correct year. If the patient's answer is incorrect and is greater than 5 years from the current year, or the patient chooses not to answer the item, or the answer is nonsensical, the response would be 0. Code 1 will be appropriate if the patient's answer is incorrect and is within 2 to 5 years from the current year. If the patient's answer is incorrect and is within 1 year from the current year, need to select code 2. And if the patient states the correct year, add response 3. Coding instructions for C0300B, able to report correct month. If the patient's answer is incorrect by more than 1 month, or if the patient chooses not to answer the item, or the answer is nonsensical, the response would be 0. Code 1 will be appropriate if the patient's answer is accurate within 6 days to 1 month. And if the patient's answer is accurate within 5 days, then need to select code 2. Count current date as day 1. Coding instructions for C0300C, able to report correct day of the week. If the answer is incorrect, or the patient chooses not to answer the item, or the answer is nonsensical, the response would be 0. Select code 1 if the answer is correct. Rules for stopping the Bims interview before it is complete. Stop the interview after completing C0300C day of the week, if all responses have been nonsensical, or there has been no verbal or written response to any of the questions up to this point, or there has been no verbal or written response to some questions up to this point, and for all others the patient has given a nonsensical response. If the interview is stopped, do the following. Code dash in C0400A, C0400B, and C0400C. Code 99 in the summary score in C0500. If patient responded well up to C0300C, then the Bims assessment will continue to other sections. C0400 recall. There are 3 responses in A, B, and C sections of C0400. If the patient cannot recall the word, even after being given the category cue, or if the patient responds with a nonsensical answer or chooses not to answer the item, then the appropriate response would be code 0. Select response 1 if the patient requires the category cue to remember the word. And code 2 is correct response for those patients who can correctly remembers the word spontaneously without cueing. C0500 Bims summary score. Coding instructions. The total possible Bims score ranges from 00 to 15. If the patient chooses not to answer a specific question, that question is coded as incorrect. If the patient chooses not to answer 4 or more items, then the interview is coded as incomplete. To be considered a completed interview, the patient had to attempt and provide relevant answers to at least 4 of the questions included in C0200C0400C. Code 99, unable to complete interview. A. Patient chooses not to participate in the Bims. B. If 4 or more items were coded 0. C. If any of the Bims items is coded with a dash. Dash indicates no information. Coding tips. Occasionally, a patient can communicate but chooses not to participate in the Bims and therefore does not attempt any of the items in the section. This would be considered an incomplete interview. Enter code 99 for C0500, Bims summary score. Examples. The patient's scores on item C0200C0400 were as follows: 3, 2, 2, 1, 2, 2, 0. Coding, C0500 Bims summary score would be coded 12, sum of C0200C0400C. The patient's scores on item C0200C0400C were as follows: 2, 2, 2, 1, 0, 0, 0. Coding, C0500 Bims summary score would be coded as 07, sum of C0200C0400C. That's all about hearing, vision, health literacy, and Bims assessment. I will meet you again in next video and will share about remaining sections, which includes pain sections, CAM, PHQ 2 to 9 and other important changes. Till then, thank you and happy coding.